It is coming up on 5:30, time for our Two on Your Side Town Hall. We're so glad that you're here with us. I'm Kate Welsh-Schofer.
Hello, everybody. Thanks for joining us on this Tuesday. I'm Michael Wooten. 849-2200 is our text line. And I tell you, we've gotten a lot of messages from our viewers today as we're going to be discussing challenges with administering the vaccine. Pharmacies are, of course, inundated with calls right now. Many of those eligible are frustrated with delays. We have a member of the governor's distribution task force on live to answer the questions that you've sent us.
Plus a tweet with more than 181,000 retweets claims the president has a lot to lose if he is impeached, including his pension and travel fund. But is that true? We will verify it for you.
And then later on, we're getting an outsider's perspective on this Saturday's big playoff game between the Bills and the Ravens. We'll talk about the odds and how the forecast could even be a game changer.
But first up, breaking news in what has been a sluggish vaccine rollout nationwide. The Trump administration making a major policy shift today.
All available doses of the coronavirus vaccine will now be released nationwide. States have been told to immediately begin to vaccinate every single American 65 and older, as well as tens of millions of adults who have health conditions that put them at higher risk of potentially dying from the disease.
Now, up until now, millions of vials have been held back to guarantee that second doses would be available to those who already received the first dose. But now the government says it is confident enough in the supply chain to make this change. So joining us live right now is Mike Duteau. He is the president of the Community Pharmacy Association of New York, which used to be the Chain Pharmacy Association in this state. He's also a member of the governor's Vaccine Distribution and Implementation Task Force. We know you are a very busy man, Mike, so thanks for your time tonight.
Good evening, Kate and Michael. Thank you for the opportunity. It's great to be here.
Of course, it's great to see you. We want to start with the big question that people have really here across the state and around the country, wondering when they're going to be able to get their shots, right? Obviously, it is a complicated answer. Pharmacies are being inundated with phone calls right now to schedule appointments. Of course, no one has enough supply right now. Can you give us an idea of when you think local pharmacies will start to receive shipments and how the process is going to play out now that more people are eligible to get the vaccine?
Absolutely. So that's a great question. You know, I think capacity definitely has been a concern in previous weeks, but confidence is there. Pharmacies today across the state, especially in central New York, receive supply of the vaccine. They're scheduling clinics and doses for tomorrow. So I think you're going to see a lot of movement in community pharmacies starting tomorrow for sure.
As we mentioned, states have been directed today to expand access to COVID-19 vaccines to everyone ages 65 and up and any adult with underlying health conditions. And Governor Cuomo says that brings the total number of eligible New Yorkers to 7 million. So the state's only getting 300,000 doses per week. You are on the state task force. I want to listen for a moment to what the governor said about all of this earlier today.
At 300,000 per week, how do you effectively serve 7 million people, all of whom are now eligible, without any priority? So in other words, if I'm 90 years old, I'm in the same class as a person who's 65 plus. If I'm 90 years old and I have cancer and heart disease, I'm in the same category as a person who's 65 plus.
So New York already had people 65 and older as eligible, but what about this federal directive now that it should also include adults with those underlying conditions?
So I think that makes sense, right? This has been, an evolving situation. It definitely has been fluid. Every day we have a chance to evaluate how this has played out and make changes to the plan. And I think, again, as capacity increases and community pharmacy is now an important part of the solution, being able to immunize adults 65 and above, that opens up access for important patients and prioritized populations elsewhere. So, the governor has done really just an excellent job being able to pivot when necessary. There are so many moving parts, from the manufacturers to distribution to providers to the public, and pulling it all together and being able to, again, pivot when necessary to make sure that we can continue to roll this out and cover any ground that perhaps was lost early on. The team has done really an excellent job, and I think pharmacy is really excited to be an important part of the solution.
Some of the questions we got today, Mike, were about how is New York doing compared to other places. We checked the CDC's tracker, which is keeping track of the whole country to see how people are doing in terms of getting these vaccines into people's arms. New York is kind of middle of the pack in terms of vaccines administered per capita. So 18 states are doing a little bit better than us. Many of them, though, are small. However, you do have Texas, for instance, doing just slightly better than New York. The numbers show that here in this state, almost 600,000 people have actually gotten the shots. As a member of the task force, what do you think New York can do and will be doing in the days and weeks ahead to even improve on these numbers?
Again, it's continually evaluating the situation. I think you'll see New York accelerating. I hate to have a pun here, but it really isn't apples to apples, right? We have the Big Apple. New York City presents its own challenges. We have very rural markets upstate, and you have to have a plan that encompasses all of that. And I think the New York plan was very focused on ensuring that all New Yorkers would have proper access to the vaccine. And you will see as capacity increases and providers come online, New York will continue to accelerate that rollout. It's a very thoughtful, very strategic plan. And I will say there are calls daily, multiple calls, late nights, weekend calls. The governor and his team and the task force, along with all of the providers, are really working hard to ensure that New York is at the top of that list.
We want to get to some specific viewer questions now, and the first one is more of a comment from Allison in Tonawanda. So she says that she was helping her grandparents schedule appointments for their vaccines and says it was very frustrating. Eventually they were able to get two on the same day, but at different locations in Rochester. So she says her grandparents are in their 80s and actually pretty tech savvy, but doesn't think that they would have been able to figure it out without her. What advice, Mike, do you have to those who maybe don't have someone to help them sign up?
Yeah, so right now I think technology is definitely something that is a very big focal point of the task force, and again, all of the providers. So, the state at the county level had technology deployed. You could sign up online and get your appointment if you qualified for 1A and now 1B. Many of the pharmacies, I know that Kinney Drugs in central New York had a very sophisticated sign up and scheduler tool that worked extremely well. Unfortunately, about 7,000 appointments were taken in 2 hours. And I know a lot of the other chains, a lot of our members are using technology to really help patients in the easiest way possible get appointments or even change appointments so that they can be more convenient if multiple family members are looking for shots. The phone is probably the most difficult way, right? It takes a long time to explain to people how to sign up, to take down the information. And most pharmacies, whether you're a large chain or a community independent pharmacy, have social media. They have the technology that is starting to ramp up to be able to support this process. So I would highly encourage making sure that you're in touch with your pharmacy through social media, checking out their website, and really taking advantage of any technology that is available today.
Finally, Mike, we're almost out of time, but this is one of the questions we got from a bunch of people today. Specifically, this is how Heidi in North Tonawanda put it. We'll show the message that she texted to us. She said, I'm eligible for the vaccine, but the website states that there are no providers within 100 miles of my address in Niagara County. Where should I look to find a provider? What kind of advice would you give Heidi and other people who are having these difficulties navigating some of this?
Yeah, so definitely starting with your county Department of Health. I think that is the best place to start. And I do know that many pharmacy providers, as they ramp up, will be going offsite and doing clinics. So that's certainly a possibility in the very near future as well. But the county Department of Health is a great starting point for everybody, because if they are not doing the clinics, they certainly are a resource to help point patients in that direction.
We've been chatting with Mike Duteau, a member of the state's Vaccination Distribution Task Force and president of the Community Pharmacy Association of New York State. It can be overwhelming. There's so much information. So, Mike, we really appreciate you taking the time to answer these questions tonight.
Yeah, thanks again for the opportunity. We really appreciate it. Pharmacy is proud to be part of this effort. Thank you again.
Love to talk to you again as this, as you say, continues to ramp up.